my name is Christina Wallace. I'm going to demonstrate how to do an IM injection. The first thing I'm going to do is verify the MAR. Also, I'm going to drop the medication before I go into the patient room, so I will make sure that I have clean hands before doing this. I would have my supplies, so my needle, but I would have a different needle on it. My medication. I would take my top off, take the top off my solution. I would pull back to inject air for however many mils of medication that I'm giving. Then I would invert it, and then I would let it go in. And sometimes you have to give it a little help. I will also make sure that I get all the air bubbles out as well. Okay, I will pull back. I have what I need. I will recap my needle. I will get another nurse to verify with me, and I will also label this before I go into the patient's room. Now I will go into the patient's room. I will let them know what they're getting. I'll verify who the patient is with a wristband. I will wash my hands, perform hand hygiene, put on gloves. And then I will check the different sites of the patient on where I can give the medication to. I can either do the deltoid in the arm. I can do the ventral gluteal, which is right in here, the vastus lataris, which is kind of in the thigh, or the dorsal gluteal, which is in this area. And what I would do is I would take my alcohol pad and also depending on the volume of medication that you're giving too, depends on the site. I would cleanse the area in a circular motion, and I'll also do my guide again. I would uncap my needle. It would be safer than this. And also they want you to do the Z-track. So I would pull back, insert, then I would aspirate to make sure that I'm not in a blood vessel. Once I don't see anything, I would slowly inject the medication. I will wait 10 seconds before I pull out the syringe. Once I pull out the syringe, I will not recap my needle. I will get an alcohol pad and hold it to the area. Once I'm finished with that, I will dispose of the needle safely. I will take off my gloves, perform hand hygiene, and document what I've done.